Hi, my name is Garrett Matthews, and today I would like to introduce a research article that I found regarding the use of ketamine to treat depression. The article is titled, "Are Ketamine a Rapid Onset and Sustained Antidepressant Without the Psychomimetic Side Effects?" The names listed below were the researchers involved in this research project. A little bit of background leading into this research project was that the World Health Organization tracks annually the number of patients worldwide who are clinically diagnosed with depression, or one of the various forms of depression. As of 2020, they estimate that 350 million individuals have been clinically diagnosed with a form of depression. Over the years that they have tracked the number of people who have been diagnosed with this condition, their research shows that each year this number continues to compound on itself, leading to become a very big and an important world health problem. So currently there are two classes of medications that are very commonly used in the treatment of clinical depression, one of which being monoamine oxidase inhibitor, an MAO inhibitor, and selective serotonin reuptake inhibitors, SSRIs. These two of many medications that are offered to patients are very effective in the treatment and management of this disease. However, the research shows that on average, it takes about 30 days of use by the patients before they actually have enough bioavailability to begin seeing the positive effects of these medications. These researchers involved in this research project saw the gap in care between receiving the medication and the 30-day window, and wanted to close the gap for patients who suffer from severe forms of depression and people who have suicidal ideations, and sought to find a solution that would have results in a shorter period of time. Ketamine came about in the mid to late 1950s. Ketamine is most commonly known originally for its use in veterinary medicine. Ketamine is a very strong sedative and was originally used for surgical procedures on large animals such as horses. However, over time, as ketamine continued to be used and better understood, ketamine was found to have various options in human medicine as well. Researchers began hypothesizing about the use and treatment for various forms of mental illnesses. For this research project, the researchers hypothesized if they could recreate some of the conditions of depression using mice, and if they could recreate these conditions, administering ketamine, would they be able to, one, stop the progression of what leads to clinical depression, and two, would they be able to do it in a shorter period of time than what most of the current medications offer for these patients. The two models that they chose to do were social defeat and learned helplessness. In order to conduct this research, male adults aged 8 weeks were used for the social defeat model, and male rats 7 weeks old were used for the learned helplessness model. there were two forms of ketamine used with different potencies, and a control of normal saline used to contrast against the two potencies of ketamine in order to get a accurate research model for the use of ketamine in this treatment model. For the social defeat model, everyday mice were exposed to a different aggressor mouse. Over a course of a couple days, what these researchers were able to do was place a group of mice, with one mouse being an aggressor mouse, in a situation that would lead to conditions that would ultimately mimic social defeat models. As soon as they were able to identify that the criteria was met with one specific mouse showing the effects of social defeat, that mouse was then used in the administration of ketamine. For the learned helplessness model, mice were again placed into a controlled environment, and except in this model, mice received small electrical shocks throughout their daily activities, creating a chaotic and unorganized day-to-day pattern of life that ultimately led to a learned helplessness model. As soon as the criteria was met and the mice showed all of the signs of learned helplessness, they were then received the ketamine and were followed for the period of time afterwards to show if the ketamine had any reversal effects on these conditions. Here are some of the research that was found with both studies. Important to note on this slide here is that within approximately 30 minutes to an hour, these researchers were able to see positive effects of reversal of the hormones secreted by the brain that created the depressive conditions after the administration of ketamine. For the results of the social distress model, ketamine significantly attenuated the reduced spine density. What they ended up finding out through this research model is not only was ketamine effective in stopping this, but they also found that when they researched the spine, when the mice were under social distress models, they had an increased spine density. Following the administration of ketamine, that density was actually reduced, showing that it had a very positive effect on these mice. For the learned helplessness model, again, they showed significant attenuation of the learned helplessness, and when they were reintroduced to the social group of mice following the administration of ketamine, showed patterns of behavior inconsistent with learned helplessness, showing a cessation of the learned helplessness conditions. In conclusion, these researchers were able to find that a single dose of ketamine was effective in the cessation of the learned helplessness and social models of the depressive conditions. Thank you.